What is PCOS? Polycystic ovarian syndrome (PCOS) is one of the most common endocrinopathy. Millions of women are affected with it. PCOS is prevalent in all age groups of females, up to 36% in adolescent girls and up to 22.5% in women in India.
Pathophysiology. Pathophysiology of PCOS is very complex and it involves multiple pathways. Insulin resistance and PCOS have a very close association. More than 75% of PCOS patients suffers from insulin resistance in India. Insulin is not just a metabolic hormone but has co-gonadotropin action in ovary as well. First article reporting an association between PCOS and hyperinsulinemia was published in 1980, which has been consistently increased. Two pathways of insulin signaling: metabolic pathway in skeletal muscles, liver and adipose tissues, and mitogenic pathway in ovary. In healthy condition, intracellular insulin signaling starts after binding of insulin to its receptors in metabolic pathway. This intracellular signaling involves activation of insulin-dependent epimerase enzyme. Epimerase enzyme converts myoinositol into D-chiroinositol. D-chiroinositol, being a secondary messenger of insulin signaling system, facilitates insulin signaling and thereby maintains blood glucose level. PCOS involves post-receptor binding defect of insulin, leading to defective intracellular insulin signaling in metabolic pathways. Epimerase activity gets affected negatively due to defective intracellular insulin signaling, resulting into less conversion of myoinositol into D-chiroinositol. This leads to deficiency of D-chiroinositol, results into insulin resistance and compensatory hyperinsulinemia. Hyperinsulinemia is associated with T2DM, HT, and METS in PCOS patients, leading to development of symptoms of hyperandrogenism like hirsutism, acne, alopecia, etc. Insulin follows mitogenic pathway in ovary, which never becomes insulin resistant. This is known as insulin paradox or selective insulin resistance theory. In PCOS women, excessive availability of insulin in ovary due to compensatory hyperinsulinemia stimulates epimerase activity, leads to excessive conversion of myoinositol into D-chiroinositol to such an extent that causes myoinositol deficiency in ovary. Myoinositol being a secondary messenger to FSH, myoinositol deficiency leads to follicular maturation arrest and poor oocyte quality, resulting into infertility. Hence, in women with infertility associated with PCOS, there is a deficiency of both DCI and MI. So adequate DCI and myoinositol supplementation is required to manage infertility with PCOS. To address these problems, BioSearch Life from Spain has discovered caroinositol, which is patented and world's first D-chiroinositol from the natural source. Radiva contains caroinositol, which corrects the DCI deficiency in skeletal muscle, liver, adipose tissue. It is the secondary crucial messenger in insulin signaling, improves insulin sensitivity, and reduces hyperandrogenism. It is recommended in females suffering from PCOS, especially young girls. It helps to improve PCOS condition and overall cosmetic symptoms associated with PCOS. Radiva significantly reduces hypoandrogenism in PCOS. Reduces total testosterone by 38% compared to baseline. Reduces free testosterone by 55% compared to placebo. Increases sex hormone binding globulin by 92% as compared to baseline. Decreases levels of DHEAs by 47%. Decreases levels of androstenedione by 22%. Radiva improves hyperinsulinemia with effective reduction in plasma insulin levels and insulin resistance. It also improves insulin sensitivity index and glucose-insulin ratio. Radiva improves level of luteinizing hormone and effectively reduces LH-FSH ratio. It also shows effective reduction in skin problems such as hirsutism and acne. Introducing Radiva MA for infertility associated with PCOS. Combination of myo-inositol plus with caroinositol ensures effective PCOS management. Studies have shown that myo-inositol supports follicular maturation and restores ovulation. Caroinositol in PCOS women helps to reduce hyperinsulinemia, hyperandrogenism, LH and LH-FSH ratio, and also reduces oxidative stress. Radiva MA is effective in restoring ovulatory function and has demonstrated significant improvement in matured follicles. It also demonstrated promising number of successful pregnancies. Radiva is indicated for management of PCOS in young women to improve metabolic and cosmetic problems. Radiva MA is indicated for the management of infertility associated with PCOS in women with childbearing age. With dosage of 1 tablet BID for minimum 3 months for both Radiva and Radiva MA. So, for effective results and promising results in the management of PCOS, doctors must prescribe Radiva in young females with PCOS and Radiva MA in females with infertility associated with PCOS.